Hey everyone, I hope you're doing well and are having a flare-free day. Thanks so much for coming to my channel. In today's video, I wanted to talk about spotting in between your period, what it looks like, and why it might be happening. My channel also focuses on endometriosis a lot, so I want to also outline why you might be spotting when you have endometriosis. When you are bleeding or spotting in between the time of your period, it can first be alarming because you're like, I am not expected to have my period anytime soon. And when you wipe or you have spotting in the toilet, it can be really alarming. And so there are normal reasons, totally normal reasons why you might be spotting in between your period, meaning that you have light bleeding that happens. Typically it's a pink, red, or brown color that you might see. It's not very heavy. It's just a couple of drops that you might see on that tissue or in the toilet. But there are also reasons why you might be spotting that you should be talking with your doctor about. Generally, it's a good rule of thumb to go talk to your doctor about any spotting or bleeding that you are having before your period, after your period, or nowhere near the time of your period, as it could be a sign of something more. So again, the color of that light spotting might range from pink, which is just blood that's been diluted by other fluids or discharge, so cervical mucus is very common. Red is another color that you might see, and brown. So one of the most common times individuals notice spotting or that light bleeding is a couple of days, 1 or 2 days leading up to your period or following your period. Especially at the end of your period when your flow is a lot less and things are generally just taking their sweet time to exit the body. A second reason why you might see spotting or bleeding before your period or after is low progesterone levels. Spotting 2 or more days before the time of your period can signal that low level of progesterone, and it's typically seen in the second half of your menstrual cycle, so the luteal phase leading up to the time of your period. Progesterone levels can typically rise and fall during the menstrual cycle, so that's something to keep in mind too. Progesterone supports menstruation and pregnancy. Low levels, like I've mentioned, can impact menstruation and fertility, so lower levels than anticipated can impact the body and can cause spotting. So again, if you're spotting 2 or more days prior to the start of your actual period, it could be a sign of a lower level of progesterone than typically seen as normal levels on a blood test. A third reason why you might be spotting is during ovulation. So when ovulation happens, so when that egg is released from the ovary, it can cause mid-cycle spotting. It is considered normal, and it impacts approximately 5% of individuals who menstruate. So this happens because of a dip of estrogen, which is common around this time of your cycle. It is seen as one of the more common reasons why you might see light bleeding or spotting before the time of your period. There are a lot of ways that you could track ovulation and where you are in your cycle. There are tons of amazing apps. I think Flow does it, so Flow app, and I'll link it down below. I also think that there's like online templates that you could use to kind of track where you are, or even write it down in your notebook. Again, if you want to talk to your doctor about it, and I recommend that you do, just to kind of follow up on things, just to make sure that it is ovulation spotting and not something more. Another reason why you might see spotting or light bleeding is implantation bleeding, meaning that the egg that was released from the ovary during ovulation has been fertilized. So 10 to 14 days after implantation or being fertilized, you might see light bleeding or even like a light period. So a little bit heavier than that light spotting, but it shouldn't be seen as like a full-blown period. When I was pregnant with my daughter, I noticed implantation bleeding and I was like, oh, what is this? I ended up going to my doctor and getting some tests done to see if I was actually pregnant, and lo and behold, I was preggo. And so that can be a reason why spotting might happen. But I also did experience bleeding during my pregnancy. It was around the 9-week mark, which is a very scary thing to see when you are pregnant. It was caused by a subchorionic hemorrhage. So basically, I want to just outline that light spotting at the beginning of a pregnancy can be seen as that implantation bleeding, but any bleeding during the rest of your pregnancy should definitely be seen by your doctor immediately. You want to make sure that everything is a-okay, and I do want to say baby is a-okay. She's almost 2. I can't believe it, but yeah, it was a scary moment, but just want to highlight that some bleeding outside of your period is not related to normal spotting, especially during your pregnancy. So definitely talk to a medical provider if that is happening. Not everyone experiences that implantation bleeding. So basically you have your uterus, and when that egg is fertilized and attaches or implants to the side of the uterine wall, waiting to just grow a baby, sometimes that friction and that connection can cause light bleeding. Another thing related to hormone fluctuations in the body is the transition between perimenopause to menopause, or even transitioning into the perimenopause state. So that's just because hormones are fluctuating and changing, and your body is reacting to that change. So it can cause a reaction that causes light spotting or bleeding. Another reason why you might see light spotting outside of the time of your period could be related to vaginal infections or STIs. Now, there are a lot of stigmas related to STIs and infections in that area of the body. A lot of them are easily curable. So if you do go to your doctor, just get some tests done to just confirm if that's actually the case, and medication can often be provided to support you. Also, after intercourse, sometimes the friction can cause micro tears. So you might see some light spotting or bleeding following intercourse as well. If that is happening, I would take a note of it and just check with your doctor just to confirm that everything is a-okay, because that could be a reason why as well. A side little note and a loving reminder to be up on your STI testing, especially if you have a new partner. You could go as buddies to go get tested. It could be a fun second date, third date, fourth date situation. It's just really important to know your overall health and well-being. Some STIs can be asymptomatic, meaning that you don't have any symptoms whatsoever. And I personally would want to know what's going on with my body. It can be nerve-wracking and daunting to say, hey, I want to get tested for this, but it's really important to see what's going on and to make sure that we have all the information ahead of being intimate. So health conditions like endometriosis and many others can cause light spotting or bleeding outside of the time of your period. Conditions like polyps, fibroids, PCOS, and some cancers can cause light bleeding and spotting outside of the time of your period. Because my channel is more solely related to endometriosis, I'm going to dive into some reasons why endo might be causing that light bleeding outside of the time of your period. Endometriosis itself doesn't cause the uterus to bleed abnormally. However, endometriosis can indirectly cause spotting or light bleeding. Ovarian endometriomas, or known as chocolate cysts, and I'll post a video up here about it that I've talked about before, can cause that light spotting or bleeding outside of the time of our period. These ovarian endometriomas or cysts can cause pressure on the ovary. It can cause that ovary to not be able to respond effectively to those hormones being sent from the brain. This can lead to abnormal hormone production and possible bleeding abnormalities, meaning that light spotting can happen. Many medications related to endometriosis pain management can cause abnormalities in bleeding, meaning light spotting can take place. The response to these drugs and medications can vary, so definitely important to keep note of if you're having new medication or you're testing out something new with your body and endo pain management and you're seeing light bleeding, it's really important to document it and bring it up to your doctor or specialist. Abnormal bleeding has been seen as a very common sign and symptom of Depo-Provera, so a medication provided for endo patients. Lupron and other medications have also been cited to cause that abnormal bleeding or light spotting before the time of your period. This is because the medication can sometimes interfere with the normal ovarian hormone production. Stress, both physical and emotional, related to endometriosis can cause light bleeding and spotting, as well as some surgeries, including excision surgery for endometriosis and ablation surgery for endo, can cause some light bleeding and spotting following the procedure. This can be caused by the tools or instruments used to navigate the cavity of the pelvic zone, causing irritation that leads to that bleeding. If the ovaries are also included in endo surgeries, it can take up to 2 to 3 and even 4 months to get back to that normal hormone balance that we're looking for. So this can cause abnormal bleeding or light spotting before the time of your period. So these are just some of the reasons related to endometriosis more specifically, why you might see light spotting or bleeding outside the time of your period. Again, important to jot down and write or journal any symptoms that are new or recurring related to that light bleeding that you see, as it could be something more related to those cysts that we talked about or some complications following surgery. It's not an exhaustive list, but again, it is important to talk to your doctor or endo specialist if you're seeing this type of symptom. Hormonal birth controls or emergency contraceptives, so like Plan B, can cause some light bleeding and spotting to take place before your period. I hope this video has been helpful and informative, especially around the endometriosis side where you might see that light bleeding or spotting take place before your period. Your menstrual cycle is a beautiful, wonderful thing, and the body is telling us so many things without speaking directly to us. Light spotting and bleeding is sometimes normal, and sometimes it could be a sign of something deeper. So again, definitely just talk to your doctor to just figure some things out, ask questions. And if you're not getting the answers that you're wanting or the resources that you're looking for, always seek a second opinion, because your health matters and your body matters. So with that, I cannot wait to talk to you on the next video.